When hormones get wonky in perimenopause and early menopause, that's the highest rate of depression and anxiety. Estrogen has over 400 things that it does in your body, and it's in literally every cell. So it's very heart protective, very cardiac protective, very protective for our brain.
Welcome to Wellness, your ultimate guide to unlocking your full human potential through biohacking. I'm your host, Ashley Deely. I'm a certified sports nutrition coach, former personal trainer, and Pilates instructor, and I have a degree in kinesiology. My goal is to help you improve and elevate the quality of your life. When you leave a review, it makes a positive difference. Whether you're listening on Spotify, watching on YouTube, or listening on any other streaming app, it helps listeners just like you find this hidden health information faster. If you're constantly wearing Bluetooth headphones, I have some surprising news for you. Your headphones are constantly emitting EMFs. EMFs are classified as a group 2B carcinogen, which can cause headaches, fatigue, ringing in the ears, tinnitus, and even fertility issues. Thankfully, there's a lot of ways to reduce your exposure. The first way is to stop using Bluetooth headphones and don't put your phone near your head. Just using wired headphones can still conduct EMFs right into your ears. That's why I love anti-radiation headphones, which are like normal wired headphones, but safer. Unlike other headphones, the ones that I love use a hollow air tube between the speakers and the earbuds. It's one of the best ways to reduce your EMF exposure. To find out which headphones I love and that I'm speaking of, visit ashleydeely.com/headphones. That's ashleydeely.com/headphones. America hasn't updated its beauty laws in over 80 years, and the cosmetics industry is highly unregulated. But Araza Beauty is the first paleo-certified makeup line in the US, made with real ingredients you can pronounce. Their formulas are nourishing and actually good for your skin, and they promote that youthful glow and high performance results. Visit arazabeauty.com/ashleydeely, ARAZA. That's arazabeauty.com/ashleydeely. Today's guest is Christine Farrell, a true pioneer in the field of hormone health with over 2 decades of dedicated practice. She is renowned for her expert management of hormonal imbalances in both men and women, but her work extends into some of the most critical and sensitive areas of medicine. Christine's expertise is deeply rooted in both academia and cutting-edge clinical research. She's an associate clinical professor at UCLA and has collaborated closely with renowned researcher and surgeon Dr. Rebecca Glazer on pioneering studies investigating the use of bioidentical hormone therapy in breast cancer survivors. Christine's approach is uniquely holistic. She believes in treating the whole person, not just the symptoms. She incorporates both traditional and alternative therapies to create personalized regimens which address each patient's specific hormonal, nutritional, physical, and emotional well-being. If you're struggling to lose weight, irritable, can't sleep well, or you're just feeling off, this episode is for you because today we're diving into all things hormones. Christine, welcome to Wellness.
Thank you. So nice to be here.
I've been following your work for a while, and you are one of the testosterone pellet experts. Why do pellets get a bad rap?
I think there's a lot of reasons for that. I would say the main reason is that people don't know about them, number one. And number two, because there's been a bunch of these pop-up clinics, I call them Doc in the Box, where a provider can go away for a weekend, a provider who knows nothing about hormones, and learn how to pop pellets in people without understanding why they're doing it. And they're doing it solely for financial purposes, which, fine. But at the end of the day, it's harming patients. They're not feeling good, and they're getting these incredibly high levels, lots of side effects, and therefore it's giving pellets a bad name.
I like that Doc in a Box. Pretty funny because I feel like, and I've heard you mention this before, just because you went to medical school doesn't mean you know anything about hormones.
Yes. 100% true, because honestly, my training, I would say, was all of about 4 hours of menopause, and none of it was about what to do with it. It was like, this is what it is. I teach for a major university, and it wasn't until this last year that I was asked to lecture about menopause. I've been doing clinical teaching where, I teach some of the kids in the clinic, but this was the first year I actually got to talk about menopause and I did it all in 1 hour. So that was the entirety of their menopause education was 1 hour. So it goes to show you that most of us really don't know unless we do a lot of post grad work.
And also, I just thought menopause was when you turned 50, you had some hot flashes, you got a little angry, and then your period stopped.
Right. I wish, we all wish, like, oh, yeah, piece of cake. Yeah, no more periods. Woo. No, I mean, it's so complex. And I always tell people will say, well, yeah, but menopause is natural. And I said, well, it was natural to die at around age 50 back, a century ago. And now we fortunately live well beyond that. So what are we doing? You want to feel good. You want to have the hormones that you were given sustain in your body so that you feel good, look good, and can have a quality of life.
So let's dive in to that quality of life. Tell me why women come to see you and how you treat them.
There's lots of reasons they come to see me. Usually, majority of the time, it's that all of these symptoms, and this is the crazy thing to me, women are having brain fog, hot flashes, sleep issues, weight gain, sexual problems, all these things. And yet nobody has ever told them that this was coming. So they think something's wrong with them. And I've actually had people like that I know locally that have come up to me at the store and gone, hey, I think something's wrong with me. It might be my hormones. I'm not sure what's going on. I mean, how sad is that? So there's a myriad of symptoms, but usually it's just somebody doesn't feel right. They feel tired, they feel sad. The weight gain is a huge one. We hear that constantly. But sleep disruption, mood issues, and yeah, it's really scary for women because they don't have any idea. And then of course it's like some friend of theirs goes, "Oh, you should go see Christine because I've been seeing her for 5 years," and that kind of thing. So, yeah.
I had a physician on my show about a year ago, and she was saying when she, I think, was 39 or 40, she started feeling crazy. Her sleep went awry. She didn't know what was wrong. She was a medical doctor, and she just thought, I need antidepressants. That's just all I need. And then when she reached out to one of her physician friends, she said, oh, you're in perimenopause. You probably need progesterone, testosterone, but she didn't know.
Yes. Yes. I mean, how sad is that? And I'll tell you, I always tell patients, I said, I do this for a living. And when I went into perimenopause, I kept poo-pooing it and going, it must be this, must be because my husband's being annoying. It must be because I'm stressed out. It's my kids and it's this, I'm not working out hard enough. I personally went through the same thing. And then I went, oh, wait, maybe it's my hormones. We as women are also told to kind of suck it up a lot, I mean, for a better way to put it. So I think women kind of just they negate a lot of their symptoms, thinking it's stress, it's their own fault somehow. And then the symptoms get bad enough and they go, okay, well, now there's something out of my control. And it's really scary because it feels like you're very out of control when it's happening.
Can you walk me through some of these symptoms that we experience in perimenopause?
The symptom that most women start to get initially is mood changes, irritability, feeling like they can't handle stress, feeling very overwhelmed. Usually that's accompanied by sleep disruption. They're not sleeping. They're waking up at, the 3 a.m. They can't go back to sleep. Women who've never had anxiety now have anxiety. The smallest little tasks make them feel completely overwhelmed. Usually because they're not sleeping too. There's some brain fog. Their sex drive plummets, and weight gain is a huge complaint because all of a sudden they're going, okay, this is not my body. I used to be able to do these certain things and now it's not working anymore. And then obviously the periods, not always, but frequently the periods are getting irregular, either lighter, heavier, closer together, farther apart. But some women that doesn't happen. So they think, okay, it can't be my hormones because my periods are just fine.
You touched on so many things, and I feel like there's so many avenues to go down. So, if we're feeling these symptoms, how do we find relief?
It's a tricky one. Perimenopause, I always say, is the hardest part to treat because it's up and down. It changes month to month. And I always tell women, you really need to seek the help of somebody who knows what they're doing with hormones because progesterone may be the only thing you need. I mean, like you said about your doctor friend, that can be a very quick fix. It may be a lot more complicated than that. There's always lifestyle that has to go in there. A lot of my patients think, well, I don't feel good. I'm going to drink more wine because that'll help me relax. And then that exacerbates all of their symptoms. So they're not feeling good. I would say that most of the time it's going to be a little progesterone, a little testosterone, lifestyle changes, things of that nature. But those are the main fixes.
Which one would you typically start a woman on? Let's say she's not sleeping well, she's gaining weight, she's feeling anxious. I know you don't know anything about her. There's a lot of variables.
Probably, I'm going to say the majority of women in perimenopause need progesterone because that is the hormone that, in the majority of women, helps them to sleep better, regulate their periods, feel calmer. Oral progesterone, again, in most women, not all women, breaks down into GABA in the gut. So it's a calming neurotransmitter and it helps them sleep and they feel more relaxed. There are a handful of women, and I am one of them, that when we take progesterone, we feel irritable and depressed. So progesterone's never been my friend. And it's hard for women who are going through perimenopause who have the progesterone intolerance. So I always throw that out there that there are a few women who go, well, yeah, my doctor gave me that and I felt worse. That's a tricky one, not going to lie. But that would be a much smaller percentage of women. The majority, progesterone is your friend because that's the hormone that drops off the most in perimenopause typically.
And if someone is experiencing negative side effects like you were, could they take it in a different form, or is there something else they need to consider?
A lot of women do okay with a topical. Some will use it as a vaginal suppository because then you don't get that same breakdown in the gut that leads to these other neurochemicals. And a lot of times they tolerate it better. One of my counterparts who's on Instagram, et cetera, she has a topical that she has created that she sells, but she uses it with some melatonin because it has a much more calming effect. And then people can take it at nighttime. I find that even though I can't take it orally, if I use it topically, it works.
I've seen a lot of progesterone supplements on Amazon, and one of my friends bought them recently, and I was like, this is like microdosing progesterone. I was like, you're not going to feel any different from it. So, what dose are you looking for?
Yeah, that's a good point. You can buy progesterone at the health food store. You can buy progesterone on Amazon. It's interesting because I've seen like full strength progesterone sometimes, not the oral, but pretty strong concentrations of topical even out there. So it's kind of a weird thing. I usually, if we're going to do oral, it's very individual. Again, everybody feels differently. So I've got some women, the standard dose is there's a 100 milligram capsule called Prometrium. And that is kind of the standard that a lot of people in the hormone world use. I find that some women find that to be too sedating or it interrupts their estrogen. It's interfering with their estrogen too much. So for the woman who's not on estrogen and just in perimenopause, some women love that dose. I think it's a high starting dose. I'm going to typically either make a sustained release 50 milligram capsule compounded, or I use a lot of sublingual progesterone drops and I'll start with like a 25 milligram and then I can fluctuate it through the month because some women say the only time I feel good is when I'm on my period. That week right after, I feel a little bad. Boy, do I feel really bad the week before. So I can go, okay, a little here, more there. And then cream, I'm usually going to tell somebody 100 milligram per gram is kind of standard. You could use a half a gram, a quarter gram. Again, depends on your need. So everybody's different, to be really honest.
Interesting. Thank you. Sounds like there's a few different ways we can take it. We're all bio individual, but maybe if we're not sleeping well, we're anxious, we can take progesterone. And then I know the first question I asked you was about testosterone pellets, which I feel like is the gold standard next level. But you said after progesterone would be then testosterone.
Testosterone in perimenopausal women. I think I like testosterone in almost all women, to be really honest with you, but at different dosages. So I never start somebody directly on pellets because my feeling is when you put a pellet in, it's in there for about 3 months and you're not getting it out. So I want to know, how do you tolerate testosterone? So I will usually do a topical cream or gel and see, how does somebody feel? And if they go, oh, I'm good, but I think I need more, or I don't like to deal with this gel, give me a pellet. I've heard my friend told me the pellet gave her a great sex drive and I really want that. Then I'll do a pellet. Testosterone helps bone density, muscle mass. I feel personally, and I see it in my patients, it helps mood. It ups your dopamine levels. So you'll feel typically happier. Obviously, it boosts your sex drive. It helps that mental clarity. I had a patient, one of my favorite stories was this lady. She was in her like mid 60s. We'd been doing a little testosterone. She wanted the pellet. She came back after her first pellet and she said, now I understand how men feel. I have this assertiveness I've never had in my life. I love this. So it kind of gives us this like, I can do that sort of a thing. And then, yeah, then there's all the good, positive physical things. Like I said, bone density and muscle, and that lean muscle helps you have less body fat. So all that.
Okay, there's a couple things I want to touch on here because I've had so many experts on my show. And one gentleman said, I would never use hormone replacement therapy on a woman after 65. And I was like, but what? So, can you tell me what kind of rules there are or what your opinion is on hormone replacement therapy after menopause?
Well, so it's interesting. When a woman says, aren't I through menopause? I say, no, menopause literally means the cessation or the stopping of your periods. And once you're in it until the day you die. So we now classify it as early menopause, mid menopause, and late menopause. So if hormones have all these benefits, like we now know that estrogen decreases heart attacks and coronary artery disease by nearly 50%. At what point does a woman's body not need that anymore? At what point does her body not need her bones to be protected and we have about a 30 to 35% decrease in dementia in a woman who's on estrogens. At what point do we tell her she doesn't need that anymore? There's a doctor, Phil Farrell. He's a Yale professor. He's been around in the menopause world for decades. Brilliant man. And I've seen him lecture. And to quote him, he said, when he pounding his fist, when do you take a woman off hormones? He said, when my 90-year-old mother passed away, I took the patch off her little butt. He said, not 1 minute before that, because why would you take away something that's helping her be healthy, feel better? At what point do you tell a woman she no longer needs it? And I will tell you that I've seen women who they're doing great and they're 70 and their provider goes, oh, you got to get off hormones, takes them off. And everything goes down. They feel horrible. They're achy. Their cognition is one that I usually see really start to change. These women start to get more dementia symptoms. So I don't see, and that all that 65 and older stuff came from the Women's Health Initiative study, which we've all heard a lot about. But it was fear mongering and the whole like, oh, you can only be on it for 5 years. You can only be on it for 10 years. You got to get off when you're 10 years into menopause. I completely disagree with any of that. And there's starting to finally be research that you can take an older woman, start her on hormones, conservatively. I'll give you another really cool story. I have a patient, she's been my patient a long time, and she came in and she said, my mother has dementia and it has gotten so bad that she calls me hallucinating every night and crying, and it's affecting my life and she's miserable. She said, do you think hormones might help her? And I said, it's possible. She brought her in. I started her on this woman was in her early 70s, early mid 70s when I started her. Put her on a very, very low dose patch. Her hallucinations and nighttime anxiety went away. She still has dementia, but it improved her capacity to feel good and her brain function so much in a very short period of time that it was life changing for her and her daughter. So, her disease is still progressive, but it really made such a difference, even that far along. So, yes, I am a huge believer in over 65.
I'm really thankful that you're sharing those stories because this is what people need to hear. They need to not be afraid of hormones anymore. I was at a birthday party in the summer and I was talking to this woman who I think she was 43 and she said she was having such a hard time losing weight. We had built a little rapport and I said, oh, you need hormones. And she goes, they'll give you cancer. And I said, no, they won't. And then I pointed her in the direction of some of my episodes. But I do think there has been so much wrongdoing in the world of hormones.
And I blame I blame the media. I blame providers. I mean, I'm sorry, but one of my biggest pet peeves is if you don't know, then keep your mouth shut. You know what I mean? If you haven't picked up a journal in women's health and all the newest literature that's been out, and it's not even that new, it's been out for over a decade about the safety and the importance of hormones. If you haven't read that, then shut your trap because you shouldn't be out there saying hormones are bad when there's all this research now that shows no, it's not. It's the other way around. And so when I first started in doing hormone treatment, which was a long time ago, because I treat men as well, there was this fear that testosterone caused prostate cancer. Well, that was negated. And then they found testosterone might make it grow faster if you have a pre-existing cancer. So we keep an eye on your PSA, your prostate levels. So men now they even take testosterone after having prostate cancer in a lot of cases. Women, on the other hand, we still are in this like, oh, it's going to give you breast cancer. It's going to give you breast cancer. No, the research, even the WHI study showed that women had a 23% decrease in breast cancer on estrogen versus placebo. Why is that not being screamed from the rooftops? And why are providers holding on to this estrogen equals breast cancer? If you get breast cancer and it is estrogen positive, it can make that tumor grow more rapidly. But the studies have shown women on hormones have a 40% decreased mortality of breast cancer versus those who aren't on hormones. So it's not killing you. It's not giving you cancer, and it has all these other health benefits. So my feeling is, okay, why are we still having that, that scare? It just makes me so sad.
Yes, yes. And this is why I really wanted to have you on today. That same girl, we traded phone numbers, we've been texting. She went to, I don't know if I'll say the program, but it's a program that anybody can go to online. And she said when she met with her provider, because she didn't have hot flashes, she wasn't going to be prescribed anything. This is the problem.
Yes. Yes. I have patients who come to me and they have never had a hot flash in their life, ever. But they haven't had a period in a year and they're having, this is the problem. We look at women instead of as an individual, we have these whatever guidelines that we call them and say, oh, if you don't meet this criteria, you can't be a candidate. But the reality is we're all candidates. If you live long enough, you will go into menopause. So the reality is what your symptoms are may be completely different than mine, but doesn't mean you don't need hormones or I don't need hormones. We both need them just for different reasons. That makes me so sad. It's like this gatekeeping of women's healthcare, and it's so upsetting to me.
I am in the same boat. And I'm also upset with women are told to wear patches for 2 weeks when I think they're really good for about 3 days. Is that right?
Yeah, and it's really ironic because the company designed the patch to be every 3 days. Even the way the insurance companies give it to you is you only get two for a week. So we have a 7-day week. So that still means that you're going to have either a 4-day and then a 3-day stretch, right? So a lot of women, they're trying to manage their patch. Like, I'll take it late on this day and early on this day, or I've had to fight insurance companies to get like a couple extra patches a month so they can actually do the every 3 days. Yeah, I like patches. I use a combination of things. I use patches on some women. I use a lot of topical compounded. I do pellets. I've used it all. I've got people on injections, not a lot, but a few that are on estrogen and estradiol and testosterone injections. It's kind of whatever works for each individual woman. You can't say like there are groups out there, and this is frustrating to me that say, and there's people on the internet, a lot of these big menopause influencers, there's only one way to do everything. And if you're doing it any other way, then somehow you're bad or you're not legitimate. And it's not the case. It's actually taking your toolbox and looking at each woman as an individual and giving that person what benefits them the best, not what the guideline says. So
Oh, that's so important. Amen. Treat the person in front of you. Now, I know I jumped right into patches, but for someone tuning in going, I think I have these symptoms. I need progesterone, testosterone, and estrogen. When do you introduce estrogen?
That's a good question. I do blood testing. Not everybody believes that you should do testing. And I had a little back and forth with somebody on the internet recently because I did a reel where I was talking about, in perimenopause, I do test because I know when to test and I know what to look for. Now, that doesn't mean every provider does. And a lot of people have said, well, the hormones change constantly in perimenopause. Frequently they do. But I had a great example patient the other day. She's been in perimenopause. We did her blood test and something had shifted. She's not feeling as good and she's missed a period this month. Well, her estradiol dropped down to 0. And I said, oh, look at that. You didn't make any hormones this month. So now, even in perimenopause, yeah, you're still getting periods here and there. If we had a little bit of estrogen to kind of just give you this nice baseline foundation, and I keep you progesterone cycled and your little, you'll feel better before, you know what it is? So kind of, again, you have to look at the patient and when they need it. If a woman suddenly her estrogens dropped and or a lot of my perimenopausal girls, their estrogens up and down and just a little bit of a estrogen baseline helps them. Others, their estrogens appear constantly and estrogen would make them feel terrible. And I've seen that happen where providers just want to give everybody the patch. And this poor woman is now bleeding to death because somebody gave her the patch. So that's why testing to me is helpful.
You mentioned bleeding. Can you walk me through why you would bleed?
When estrogen is what makes the lining thicken every month. So when you're having your normal 28-day cycle, you've got that 14 days at the beginning of your cycle, theoretically, before you ovulate, and your lining is getting thicker and thicker and thicker, and it's preparing you in a perfect world, right, to get pregnant and make a baby. And then you ovulate, well, and that's when you would make your baby. And then the progesterone that gets left behind from the corpus luteum where the egg pops out of, that progesterone either goes up, 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 up to maintain your pregnancy, or it goes up and then it drops. And when it drops, you shed your lining. So if you've got a woman who's in perimenopause and her estrogen is really high and her lining's getting thicker and thicker and thicker and her progesterone's not where it needs to be, that poor woman will have horrible periods, bleed heavily or bleed frequently. I've had women tell me I've bled for 45 days straight, constantly. I've had women need blood transfusions in the past because their hemoglobin and were so low, they were so iron deficient from this heavy bleeding. People don't recognize how incredibly difficult that is for women and how harmful that is.
Gosh, that's so this is why we need more people like you, because I'm just curious what the standard protocol would be if you went to the hospital saying you were just constantly bleeding.
Well, that's a good point. They probably at that point check your blood count and go, wow, look at you, you're anemic. We're going to transfuse you with some blood. But nobody's going to look at the root cause and go, why are you bleeding so heavily? Let's give you some progesterone. Yeah, I can't imagine the hospital doing that. And a lot of times, well, if you look back in like my mom's generation, everybody got a hysterectomy. Everybody got a hysterectomy. And because, oh, you're bleeding heavily, let's just take it out. Now, there's a doctor friend of mine from Harvard who he said, look, if we took the uterus out of every woman after she was done reproducing, we'd save her a lot of heartache. That's probably true, but it's not a small surgery, right? And most women are not wanting to just give up their uterus. So progesterone comes in at that point to be something that helps that lining not get thicker, 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 and the bleeding to get so nasty.
Okay, thank you. Now, I'm curious as well because I've heard that if you take estrogen, you have to take progesterone as well. Is that true?
That is true. So that same thickening of the lining, when estrogen first came out, they just put women on estrogen. Nobody thought about putting them on progesterone. They saw an uptick in endometrial or uterine cancer because the lining, and then everybody was bleeding too. The lining got so thick. So if you don't have the proper balance, estrogen with progesterone, the lining will get really thick and you'll bleed all the time. And then there is an increased risk of endometrial uterine cancer. So it's not that estrogen by itself increases your risk. It's that being out of balance and having a thick lining can increase your risk. Now that's interesting because Dr. Louise Newsom, who I greatly respect, she's in the UK, just published a study and they looked at 200 women and they looked at the levels of estrogen, progesterone, and in the UK, they call it the womb lining, which is the uterine lining. And they found that it wasn't always relevant, so that you could have perfect levels and still get thickened linings, and you could have imperfect levels and not get thickened linings. I would say, in my experience, somewhere in the middle. I've had women that their levels are perfect and I'm like, why are you bleeding? You should not be bleeding. You've got the proper amount of estrogen and progesterone and your lining's getting thicker and thicker and thicker. And other women, their levels are high and they never bleed and they feel great. I go, okay, well, so the gold standard is that we always have progesterone with estrogen in a woman with a uterus to protect the uterine lining. That's the gold standard. But like I said, there's new research coming out that is fascinating. It's brand new.
I'm curious to learn what estrogen does. Why would we take estrogen?
Estrogen has over 400 things that it does in your body. And it's in literally every cell of your entire body. So it's in your brain, it's in your gut, it's in the lining over your bone and your joints, all these things. So when it goes away, all of these things. Now, listen, can you be an old lady who never took estrogen? Sure, you could. My grandma never took it, but she had such severe osteoporosis that her own spine was collapsing on itself. So it was horrible, and she couldn't hardly walk, and she was in excruciating pain. She never had a hot flash. So there's a perfect example of the lady who never had a hot flash. Estrogen, like I was mentioning earlier, is very, very heart protective, very cardiac protective, very protective for our brain. It helps our bones be more elastic. We're rubbery, so they're not so brittle. It helps our mood. There's a lot of research that when hormones get wonky in perimenopause and early menopause, that's the highest rate of depression and anxiety and even psychosis in women. So it affects so many major, major things that to me, I kind of go, if it doesn't hurt me, it's going to protect, probably even lower my breast cancer risk, definitely lower my heart attack risk and my dementia risk and my osteoporosis fracture risk. Why would I not want to take it? So that's how I look at it. But it's a woman's choice. I always tell women, like, you don't want to take it. It is not my goal to try to upsell you estrogen. I don't make extra money by giving you estrogen. It's your choice, it's your body.
Can estrogen help you lose weight?
When estrogen is low, your body says, I love you. I want you to have hormones, and your ovaries aren't producing it anymore. What can I do to help you? I know. I'll give you this nice belly fat, this central weight, because that is number one, a producer. Red fat is a producer of some hormone called estrone in particular, which is a form of estrogen that we don't necessarily love. And it's also a storage for estrogen. So your body says, any little morsel you make, I'm storing it in this fat. So I'm going to keep this on there. There's it's a lot more complex than that, but those are two main things. And then the body also will raise your cholesterol at that point, because cholesterol is a way that we also make hormones. So hence more the heart disease piece. But yeah, it definitely affects the weight. So when you add the estrogen back in, if you're doing the right things with diet and exercise and all of that, then your body goes, I guess I don't need all of this anymore. And a lot of times it'll let it go.
I feel like I can resonate with it. If you're not making something, your body's like, here, this will be better for you.
We need to help you. What can I do? I can't make the ovaries do anything because they're tired and old.
So maybe a little over 2 years ago, I was sitting on the plane and I was speaking to this woman, and I was telling her that I was a former personal trainer, and we got into talking about health and fitness. She was almost 50 or just a little over. And she was saying that she had her fitness dialed in. I think she was doing Orange Theory, something where she was sweating a lot. She was fasting. She was trying to get more sleep, but she said absolutely nothing would work. And I feel like I had heard this story so many times when I was a personal trainer, and I felt like women in their 50s were my favorite clients because I realize now they were going through these changes that no one told them about, and nothing that she did was working.
Yes. And how sad is that? There's a whole trend, and you've probably heard this in the menopause world, of when a woman says something, believe them, right? So when a woman comes into me and says, I work out 5 days a week, I'm doing weights, I'm doing intermittent fasting, I don't eat sugar, I cut my alcohol out and I still can't lose weight and I don't know what's wrong with me. And I'll go, I trust you. I believe you. Because if your body could do what it did at 25, obviously our metabolic rate changes, and there's lots of reasons for that, decreased muscle mass and just aging in general. I tell women, I go, it's not your fault. It's not your fault. You're doing everything you can. So now let me do my piece to help you. And sometimes things like insulin resistance get triggered during menopause. We see a lot of metabolic stuff, the cholesterol, the blood sugar, all these things. And that makes it much harder for women to stay healthy and lose weight, particularly insulin resistance. So you have to kind of look at this whole picture and fix the broken parts so that they can keep, and I would say, don't give up, keep doing the right stuff. Let me fix the broken pieces, and then those things will dovetail and you'll feel great. Now, the girl who comes in, she's like, I work out every single day. Oh, yes, I drink 4 glasses of wine a night. I'm like, okay, well, we do have to work on the lifestyle piece. You don't get to, hormones are not the magic fix either. So I don't want to give it that illusion that I'm going to give you hormones and you're just going to drop all this weight and it's going to be great. You have to do both pieces together.
And you have to give your adrenals a break. You can't be going to Orange Theory 4 or 5 days a week.
100%. That's what I tell women. I'm like, you need that restorative piece in there. Like you're working, you probably got teenage girls or whatever at this point, and you're stressed out and you're, trying to be the perfect person and work out really crazy hard and all this. And yeah, you need to go take a walk in nature and breathe, please.
One of the questions that I wanted to ask you, Christine, what levels are you looking for when it comes to blood tests?
That is a tricky one because it's so individual. That goes back to, so there's kind of this standard out there. Again, back to my doctor friend from Harvard. And I asked him one time, I go, where is your bare minimum that a woman should be at for her estradiol levels in order to be protecting her body? And he said, I wouldn't want them lower than 35. And he said, because if below that, you're not getting all the benefits. Now, there's kind of a thought out there that we want to be around 80 to 100. I have patients who could never tolerate that level. They're estrogen sensitive. And if I gave them a level of 80, they'd feel PMSy. Doesn't matter how much progesterone I balance it with. They don't feel good. So I always say I use hormone testing as a guideline. I never say there has to be a particular level because everybody's different. But I can then look at, if you say, I'm still not feeling great. And I go, oh, I did your blood testing and look, your estrogen's just not absorbing through the skin. So you're down to like 10. You're obviously not getting enough where I think I'm giving you this great amount. That's where it's beneficial. I would say in a perfect world, in the average patient, I shoot for somewhere between like 50 to 100 on an estradiol level. Progesterone should be 5 to 10% of whatever your estradiol is, again, to protect your uterus. And testosterone, very individual. And I tend to run women on the high side or above the quote unquote normals because as long as they get benefit and not side effect, most of them feel better. And, people forget that we produce a lot of testosterone when we're young. It's a very important hormone for women, a very neglected hormone. And it really, if you throw that one in the balance, and women feel so much better.
Isn't the recommended lab ratio for women for testosterone 0? Isn't it like 0 is normal?
Here's the crazy thing. When you look at a hormone level, if you are in menopause and you have 0 estrogen, it won't light up as red and saying it's an abnormal level. And same with testosterone. It'll just say, I think 2 on the lab I use, 2 to 45 is normal. With estradiol, 0 to like 450 is normal. I mean, come on. So, that's why I would say labs are, if somebody says, well, my doctor told me I was normal, I'll say, okay, well, what does that mean? Normal for you, normal, ranges, again, are normal for menopause. What are we talking? So yes. Yeah. Isn't that sad? So we're not looking again at a person.
That's right. I really wanted to ask you about your time with Dr. Rebecca Glazer, who I think I've read everything she's ever published. And I really want to take this conversation into hormone replacement therapy and breast cancer. So what can you share with us?
So Rebecca Glazer, breast cancer surgeon and a pioneer in the world of doing pellet therapy. That's who I trained with. I was fortunate enough to find her and get to train with her. She's something else. She's got women, these little farm ladies out in Ohio. When I would meet them, they'd be like, I have never felt better in my life. My sex drives through the ceiling. This is amazing. So I was like, wow, look at this. I was doing hormone therapy already. And I had patients asking me, do you do pellets? I'm like, what are pellets? No, I don't know what pellets are. And then I started researching it. And then I got onto her research. Dr. Glazer has an ongoing study where a being a breast cancer surgeon, she has found that the recurrence rate of breast cancer is lower in women that she treats with testosterone pellets. And on top of that, if they had an estrogen positive cancer, she could alleviate their menopause symptoms by giving them high enough doses of testosterone that they didn't have vaginal dryness and they didn't have hot flashes. And now, do they get side effects? Yeah, she also had a gal doing laser in the next room to get rid of all the excess hair. But these women didn't care because they felt so good. They're like, look, if I can't take estrogen, I'll deal with being hairy and getting lasered. But her studies have shown again and again that she has an improved survival rate and a decreased recurrence rate using high dose testosterone pellets, and happy patients too. I'm telling you, everybody I met there was feeling fantastic.
I think it's probably the best business idea if you have a laser hair removal esthetician or whoever it would be in the next room where you're prescribing testosterone. That's amazing.
100%. I tell I have a friend who does hair removal, and I'm like, we should just like put it all together in one office. Be like, oh, you feel
Yes.
good? You're hairy? Go to see her.
Yes. Okay, one of the things of Rebecca Glazer's work that I wanted to ask you about was that if you insert a testosterone pellet into the breast tumor with an aromatase inhibitor, it can reduce the tumor sevenfold.
That to me is fascinating, and that is something that we still don't 100% understand, other than we know that higher dose testosterone I just was reading a good study about this the other day, down regulates parts of the brain that make you make estrogen. So instead of putting women on hormone blockers, which I know she was putting aromatase inhibitor at the breast tissue, there's this research. I'm going to jump off track for a minute. There's this research that she's done that in using high dose testosterone, you don't see the aromatization that people think you do. Oh, testosterone is going to turn into estrogen. It's actually shutting back the feedback loop in the brain, and it's stopping the ovaries. It's almost like when you go on the pill and the FSH drops, the high dose testosterone is doing the same thing. So you're alleviating symptoms, you're lowering the estrogen without putting somebody on an estrogen blocker. Kind of fascinating stuff. So it makes sense that at the tumor, we're finding that testosterone is inhibitory for estrogen positive tumors. So that's why she found that putting it directly at the site made a difference. Now that's still considered very risque, avant-garde, whatever you want to say in the hormone world. Most people would have my head for even talking about that, but she did the research, and there's hard, cold facts that are behind it.
I think that's so interesting. And this is why women need testosterone. I'll tell you, I feel so good on testosterone. I feel like I can do anything, and I don't really have much chin hair.
No, you don't. I don't see a beard. You're good, Ashley. I've been on testosterone. I turned 60 this year, which is hard to say.
You don't look 60, Christy.
Thank you. Well, hormones help. I've been on testosterone now since my youngest daughter was about 3. So I've been on testosterone probably like 15, 16, 17 years. And I can tell you, I am as strong in the gym as I've ever been. I backpack, I ride horses. I don't feel old. My brain function is great. So I was telling women, like, I don't tell you to do something that I don't do. Do I get an occasional hair here and there I have to pluck? Yeah. But do I have a beard? No, I do not. Is my hair falling off my head? No, it's not. And I've been on pellets for almost that entire time. So because I didn't feel good on patches, I don't absorb topical. So I'm a living example of like, pellets are great for the right person.
Yes. That is something that I wanted to go back to because I got my mom finally on bioidentical hormone replacement therapy. I think it took 2 years of interviewing people on my podcast where she was like, I think I should try this. And I was like, you should. So she's really interested in pellets. But one of the questions I wanted to ask you was she said that more recently her breasts have been really tender. And I thought maybe that's too much estrogen, but I'm not the clinician. So I wanted to ask you.
That sounds right. It's probably that she's either getting too much estrogen or not enough progesterone, because progesterone will typically inhibit that breast pain. So you're right. The thing, Dr. Glazer was really funny because she said, I really don't like doing estrogen pellets on women with a uterus. She goes, I'll do them occasionally if I really can't get somebody feeling good otherwise. The bleeding, the chances of bleeding when you do pellets on somebody with a uterus do go up because your brain is sensing. It's almost like sticking a little teeny ovary in your hip because you have this little pellet that's producing hormone 24 hours a day. Higher when you're working out or stressed, lower when you're resting or sleeping, a lot like your body does physiologically. So the brain goes, look at that, never again. I'm going to start having periods. So I have had, it doesn't happen to all my patients because I have a lot of patients on pellets who still have a uterus and they feel fine. But I have had trouble with some that are bleeding. So then you have to go really low dose estrogen. And she even said herself, she's like, I don't want to deal with the bleeding. I'd rather just give them high testosterone and not do it. So
Well, I know my mom's really interested in pellets because she travels sometimes for 6 months at a time. But I'm wondering, we don't want to go to what you call them, a doc in a box, but where
yes.
can we find someone or what questions should we be asking for pellets?
That's a really good question. You want to know how long have they been doing it? That's huge. I always say if you can get referrals from people who've gone to somebody, that you trust. Like I've been doing pellets for close to 20 years now. Who did you train with? Did you go to a weekend doc in the box, that wine you dine you, here's your pellets, have a nice life? That's not the person you want to go to. And most importantly, in my opinion, does this person do hormones? I know doctors in my area that are like, for example, there's a rheumatologist who decided I'm going to do pellets. I know cardiologist who decided he was going to do pellets. And they're doing it as a side gig. It's not, hormones are not their thing. So I would say make sure you go to somebody that knows hormones, that does all kinds of hormones. And if they do pellets on top of that, great. Then you could say, am I a candidate for pellets?
If you start taking hormones, you're feeling amazing. I know we kind of alluded to this, but do you have to take them forever?
You don't have to take them forever. I personally will take them forever. And I always tell my patients, you can go off at some point if that's what you choose. And I would go slowly. I would never want a woman to go off vaginal estrogen because elderly women die all the time of urinary sepsis in the hospital. I saw it when I worked in the hospital and in the ER. And a little vaginal estrogen can prevent that. I mean, it can be life-saving for women. There's a couple of doctors online. Rachel Rubin is a very big advocate. I love her of vaginal estrogen, and they're really pushing to get the FDA to take the black box warning off because it's not dangerous. Anybody can take it. Breast cancer patients are allowed to take it. So I think that is something I would tell women. Please never stop doing that. But if you don't want to do hormones anymore and you feel good, I'm of that mind. It's your body. It's your decision. I would encourage you for your health to at least stay on it at a moderate to low level so that you stay healthy and your bones are good and your brain is good. My mother is in her 80s. I've had my mom on hormones as long as I can remember. Since the WHI, actually. My poor mom got ripped off her hormones during the WHI, felt horrible. I put her back on hormones. And so that's 2002. She's been on them pretty much ever since. And my mom still goes to aerobics and does all her little, she's healthy. She's super duper healthy. So my feeling is I love my mom. I would not want my mom to start having all the issues that go along with not being on hormones. So I would encourage her to stay on. But I always tell women, if you're sick of it, and you don't want to do it anymore, and you want to try going off, I'll help.
Oh, I like that. That's really nice. I also have another question about estrogen for myself. I have been told by a couple providers that I'm probably too young for estrogen. By the time this recording comes out, I will be 40. But sometimes I don't sleep well. I get irritable. I have itchy ears, Christine. I will itch my ears until they bleed. I know it's individualized, but is someone at 40 too young for estrogen?
Not necessarily. So you're the perfect example of somebody I would say you should get your levels checked and you should do it. So you're still having normal cycles, correct?
Yes.
If you're having normal cycles, the time to check your blood is that week right before your period in a perfect world, like around day 21 in your luteal phase. That's when you'll see the greatest imbalances. And it does fluctuate. People go, oh, it fluctuates month to month. Yes, it does. The FSH and the LH, which are two pituitary hormones, are more like your big picture. So think like estrogen in that moment might look great, but your FSH might be getting a little high. And I'd go, Oh, Ashley, look at that. Your FSH is 32. That means your brain is saying, Ashley's not getting as much estrogen as she used to. And we're sensing that. So then I would go, yeah, guess what? You would probably benefit from a little baby dose of estrogen on the daily, maybe cycling your progesterone a little bit. The sleep can be the tricky part. This is why I like to do blood testing. Sleep can be too little or too much estrogen. You've got hot flashes, sometimes, believe it or not, with too much estrogen as well as with too little. Perimenopausal women get hot flashes too, even when their estrogen's high.
Can't win.
Weight gain, too much. They can't win. So I always tell women, like, it really does help to get the blood levels done.
Okay. Thank you for that. I appreciate it. I know it's not medical advice, just sharing some opinions. I also had Dr. Lindsay Berkson on the show who said you want it low FSH, as low as you can. Can you explain why?
When your FSH is on the lower end, that means your brain thinks that you're not in menopause and your body will respond like somebody who's younger. So, like, I just checked my FSH the other day and it's 9, and I don't feel 60 and I don't feel like I'm in menopause. I am, but you know what I mean? So, I try to do that to keep my body and my brain healthy and to feel good. Now, you have to be careful because sometimes if you get the FSH too low in some women, that's when the brain goes, I am not in menopause. I'm going to have periods again. And then there's some women love that. I have patients who go, I want to have a period until the day I die. I'm like, I can make that happen. It's not what most women want. They don't want to be 70 and bleeding, most of them. You have to know your patient.
So, what would an ideal level of FSH be then?
Again, it depends. I try to run it. So 23 is when you get 23 and above, it's considered to be menopausal. Now, that fluctuates depend even in like peri women, you'll get up and down. I try to run women who are menopausal as low as I possibly can without making them bleed. So if I can get them down in the 30s, the 20s, if I can get them down even lower and they don't bleed, perfect. But it depends. I try to get them as close to quote unquote normal as possible. I have patients though. I have a good friend. She's my patient and I cannot get her FSH lower than 80. Never have been able to. If I give her more estrogen than that, her breasts are killing her. Doesn't matter how much progesterone we do. She goes, I feel horrible. I feel fat. So she's one of my little low estrogen girls. She can't take very much and she feels just fine. So again, so individual.
Yes, that's what I'm learning. I didn't realize maybe until a year ago. And you had said it earlier, we have hormone receptors everywhere. If we have them, and if menopause is natural, then why wouldn't you be taking hormones?
Exactly. And people say, well, estrogen's dangerous. And I go, okay, tell that to the 25-year-old who's healthier and better than we are at 50. Think about, when does cancer risk go up? At 50, which is typically when we become menopausal, our breast cancer risk almost doubles, nearly doubles. Has nothing to do with the fact that your estrogen is getting higher. If anything, it's getting lower. Cellular aging, changes in hormones. So why we act like estrogen is such a bad guy when it has so many amazing things that it does, and we've had it since puberty, it makes no sense to me.
I have a two-part question, but I'm going to ask them separately. What is one thing that most women do, either in perimenopause or menopause, that you think is crazy?
Not take hormones. Be afraid. I've had women who are doing, I had one gal who was even drinking hydrogen peroxide. She almost put herself in the hospital because it was, and not food grade hydrogen peroxide. Yeah. Because she was told by somebody who was not legit that it was going to oxygenate her. Yada. All the things women will do, they'll go to any extent to feel better and not take hormones. So I go, that to me is the crazy thing. Like you're going to ingest all these things and spend thousands and thousands of dollars going to people that can't really help you. You can't supplement away menopause. You can't exercise away menopause. You can certainly make yourself feel better. Don't get me wrong. I love supplements. I love exercise. I love a good diet, and sleep to me is one of the most important things you can ever do. But you're not going to fix it all, in my opinion, without hormones. So to say I'm going to gut it out, like, you don't get a medal for that one. Sorry.
I couldn't agree more. We're in the same boat. That's how I feel when people want natural alternatives. You can try supplements, you can try different herbs, but nothing's going to work the way that hormones do.
Agreed. Yeah, 100%. And listen, I love a combination of things. I have an acupuncturist that I refer to that is amazing. I have a massage therapist that I love. I have pelvic floor physical therapist I refer to. It takes a village. It really does. Mental health therapists or, practitioners. We need all of that. But when you're not sleeping and you have hot flashes and you have brain fog, which brain fog is literally the shrinking of the prefrontal cortex of your brain in the absence of estrogen. How sad is that? That we're going to tell women, like, oh, well, you're fine. Don't take any hormones. So, and Dr. Lisa Moscone, you've probably seen her research on brain and menopause. I mean, it's fascinating. It's such an important piece of our health. There's nothing, all of these other things that all the adjunct therapies are amazing and important, but you kind of have to do the hormones for the most part. I mean, I'm not out there saying like every single, because people get mad at me online, like, you're saying everybody needs hormones. No, I do not say that. Some women do
Mhm.
great, and I'm so happy for them. But I would say most women do need them.
I had no idea brain fog shrinks the prefrontal cortex. That's terrifying.
Yeah, there was a couple studies, I want to say they were good over 10 years ago, and they did MRIs of women on hormones, not on hormones, going into menopause, and they found that that part of the brain was shrinking. And the cool thing is, it got better when you gave them back the estrogen. It was like a little sponge that was like, yay, here's my hormones. Yeah.
Well, this is probably why then women can't remember where they put their keys or what thing they have to drive their kid to next. They're in perimenopause and they don't realize it.
Yes,
Okay.
exactly.
This is my second part of my two-part question. What's one thing you do to stay healthy that other people might think is crazy?
Good point. Okay, let's see. What do I do that people might think is crazy? I've gotten on the peptide train. Not going to lie. I've been using BPC 157. I've been injecting it. I do feel like it's helped my general inflammation. I also, Peter Attia for years talked about metformin. Life Extension has all these studies on metformin and aging. I take metformin daily. I feel great. So I'm not going to stop, you know. I don't love injecting myself with BPC constantly, but it's really made a difference. I feel much better. So,
We are in the same boat. So I had Jay Campbell on my show. I'm not sure if you're familiar with him. And he's like the father of peptides. And he was talking about, I think it's called epitelion. And you do it like once every 2 years after you turn 40. And it's like one of the anti aging ones. Now that we're on peptides, can you tell me about Kispeptin?
okay, so Kispeptin, people love Kispeptin for libido and all that kind of stuff. I would say it does have some side effects of nausea in some women. So there's that. PT 141, same stuff. It does boost libido. I've got a friend who is a nurse practitioner and she swears by it. She's like, you inject that. My God, 45 minutes later, you're golden. So yeah, I would say for some women, it's great. And listen, I am not opposed to the GLP-1 drugs. I think they definitely are great in the right patient, 100% beneficial. I've watched people's cholesterol get better. I think peptides are pretty cool. I just signed up for this whole huge class on peptides. I want to see your episode for sure because I want to hear
Yes.
about that.
Well, as long as they're not oral, you just can't take oral peptide.
Yeah. Nope.
Okay,
Yep.
good.
I,
Same
I
boat.
do. My youngest daughter is on BPC 157 orally only for she has severe gut issues and it has helped her. It's definitely helped her. But yeah, the rest of them,
Okay. I would be interested to know what kind of gut issues she has because if anyone has mast cell activation syndrome, can BPC 157 is actually not recommended for your gut in those instances. So there's certain instances where you should and shouldn't, but I'll share some
she's,
info with you.
yeah, yeah, please do. Because they've never been able to really, that poor girl's had every scope, every test done, and she's got really severe irritable. It's like an irritable bowel disease, and they can't quite classify what it is to the point of like bleeding and all kinds of stuff. So, and dietary changes have made a big difference. So, but I'd be very interested to see that information.
Yeah, interesting. Well, we can keep chatting offline. It has been so wonderful speaking with you. I feel like I could make this like a 5-hour podcast. I'm having so much fun. Christine,
Good,
as
me
we
too.
wrap up this podcast, I ask all my guests the same closing question, which is, what haven't I asked you that you'd like my listeners to know?
I think the main thing that I want to really drive home, and we definitely talked about, is hormones are not scary. And if somebody is telling you that hormones are going to kill you or give you cancer, go find somebody who has been reading a recent article and who's up to date on the latest research. Do yourself a favor and don't let the fear overtake the benefits of what you could be getting from doing proper hormone therapy.
Really great parting words. I'm so happy to have had you on today. Can you please tell my listeners where they can go to find you and find out more about you?
My website is bioidenticalwellness.com. So you can go on there, and that's my practice. I have two other practitioners who I've trained who work with me. And then on Instagram, Christine Farrell _FNPC.
Amazing. Well, we will put everything in the show notes. Christine, thank you so much for your time today.
Thank you so much for having me.
Thank you so much for listening today. If you have the time, a review would genuinely mean the world to me. You could also do a quick shout out on Instagram. I'm at Ashley_Deely or Welcome to Wellness Podcast. Your voice matters. This podcast is presented for educational and exploratory purposes only. The published content is not intended to be used for diagnosing or treating any illnesses, disease, or disorders. Those responsible for this show disclaim any responsibility for any possible adverse effects from the use of this information presented by myself or my guests. Please consult with your healthcare provider before using any products or services referenced in this podcast. The content here is for informational purposes only. Episodes on the Welcome to Wellness podcast may at times cover sensitive topics, including, but not limited to, depression, suicide, 5G, nootropics, circumcisions, birth control, the Women's Health Initiative, the use of plant medicine, abortion, geoengineering, terrorism, gender, AI, and sex, drugs, and rock and roll. You are advised to refrain from listening to this podcast if you are likely to be offended or adversely impacted by any of these topics. However, if these topics interest you, you just may have found your tribe. The information or opinions expressed on the Welcome to Wellness show are solely the views of the individuals involved and by no means represent absolute facts. Opinions expressed by the host and the guest can change at any time. The views of my guests are solely their views, and the Welcome to Wellness show does not accept responsibility for them. Any action you take based on the information contained within this podcast is strictly at your own risk. The Welcome to Wellness host, Ashley Deely, will not be liable for any losses or damages in connection with the use of this podcast. You should take all necessary steps to ascertain the information you receive in this podcast is correct and has been verified. None of the guests or contributors on the Welcome to Wellness podcast will be responsible for your use of the information contained therein. Under no circumstances will the Welcome to Wellness show or my affiliates, partners, suppliers, licenses, or guests appearing on the show be liable for any direct or indirect consequences or damages arising from your ability or inability to access this podcast. All intellectual property rights belong to me, Ashley Deely, and include, but are not limited to, the copyright and any other rights in the design. You are permitted to use the Welcome to Wellness podcast for personal use, but not commercial use without license. You may not make recordings. If you breach these terms, you lose the right to access the Welcome to Wellness podcast, and you must destroy or return any copies of the recordings you've made. Guests on the Welcome to Wellness podcast may at times provide information or read extracts from third-party copyrighted work. The Welcome to Wellness podcast does not provide any medical or professional advice within these episodes. If you take any action or inaction as a result of the content you consume from the Welcome to Wellness podcast, this is based solely on your decision, and Ashley Deely, the Welcome to Wellness podcast host, and my guest cannot be held responsible or liable for any of the consequences of such action or inaction. Thank you.